My name is Elise and I live in Trenton, New Jersey. I've had hallux rigidus and hallux valgus, also known as turf toe, and bunion surgery. Surgery seemed to go okay, but in follow-up x-rays it appeared that I had a fracture, probably the result of slipping off a crutch. About 4 months after that, we added an ultrasonic bone stimulator to help with healing, and a few months later x-rays showed that the surgical site still hadn't mended. Several months after that I was still in a great deal of pain, so the doctor decided to go in, see what was going on, because I'd had several CTs, MRIs, and we really could not detect what the problem was. Several months later I had surgery again, and I was in a cast and non-weight bearing for months, and again was still in a lot of pain. We did the best we could with x-rays and CTs, and the reports kept coming back from the radiologist saying, we're really not sure what we're looking at. There was so much hardware. So we decided to do another fusion revision. Went back in, and what the doctor did was he created rather screws and plates, a box to really hold those joints together. All this time, a few years later now, we still really weren't sure whether the bones had come together, because again, there was so much hardware. I had been x-rayed countless times. It was every 6 weeks for quite some time. It was x-rays, it was CT scans, it was MRIs. These are copies of the CDs that I have, and these are just the ones that I have. I'm sure that the surgeon has at least 3 more CDs. These tests were not done lightly. These were after my surgeon had taken my x-rays and my case to, he said, at least 10 other orthopedic surgeons. Everybody reviewed this and came to the same conclusion that there were limits to what a traditional CT could do, especially because I couldn't put weight on it in a CT. It's one thing to be in a CT looking at an organ or an elbow or a shoulder, but when you can't stand and see how weight and how your conformation plays on your injury, it's really not the best tool out there. The impact on my life has been profound. I do everything from restoring a house that's 100 years old, to gardening, to bicycling, to continuing figure skating when I can, and pain management has been a big goal of mine. Also trying to figure out why this surgical site hasn't healed. My surgeon contacted me and said he knew about this new machine and asked whether I'd be interested in it. He said in the time it would take to say hello and goodbye, the scan would be done. So when I went, it was literally 90 seconds. It was almost like stepping into a jacuzzi without the water. There were comfortable rails to hold on to. I didn't feel that I was going to lose my balance. It was like standing in line at the grocery store. I don't think I was prepared when the tech showed me exactly what they were looking at. We were looking at what could have been almost a photograph of soft tissue and hard tissue, and I went to my surgeon with it the next day, and together we sat down, brought up the images in his office, and for him it was an aha moment. I'm much more confident going into what should be my final surgery because we have mostly discounted the idea that the problem is within the joints. When we get a look at the joints and the soft tissue, we're also getting a look at the hardware and where the hardware has failed. And knowing that my surgeon can go in there and have scans right in front of him and say, we need to do A, B, and C, and not prepare for a whole bunch of unknowns, that's really comforting to me. I would recommend the Pet Cat to other patients for the ease of use, the amazing imagery. You're getting a view of your foot or your limb that nobody else has ever seen, and it opens up a world to you that you realize exactly what you're dealing with, exactly what to prepare for, and you walk away knowing that you really may have nothing to worry